Good morning, everyone. Thank you for joining us to today's webinar, Youth Vaping, What Healthcare Providers Need to Know About a Rapidly Evolving Trend. This is presented by the Canadian Paediatric Society. I'm Francine Charbonneau, Manager of Public Affairs at the CPS, and I'll be your host this afternoon. Before we begin, I would like to acknowledge that the CPS office is on a traditional unceded territory of the Algonquin peoples. All participants from across this beautiful country are resting on traditional lands of many nations and peoples. We are all grateful for the opportunity to gather in this virtual platform together. This webinar has been made possible through a financial contribution from the Public Health Agency of Canada. The views expressed herein do not necessarily represent their views. Before I introduce today's speaker, a reminder that this presentation is being recorded and will be available on the Canadian Paediatric Society's website over the next few days so you can share with your colleagues. Please use the Q&A icon to post questions. I'll be monitoring them throughout the presentation and they will be answered by Dr. Chadi during the Q&A portion of the webinar. Somebody is asking if they need to be muted. No, you're automatically muted, so we cannot hear any of the attendees. A link to the short survey, a short survey for today's webinar will be in the chat box throughout the webinar. So you can please open the link at any point throughout the presentation, as it will not be available once the webinar ends. I will leave it open for a few minutes after, but that will be your only opportunity to fill out the survey. You'll receive your certificate of attendance once you submit the survey, so it will bring you to an automatic window where you can download or print your certificate of attendance. So today we have Dr. Nicholas Chatty with us. Dr. Chatty is a pediatrician specialized in adolescent and addiction medicine. He's currently a clinical assistant professor at the University of Montreal, as well as a clinician scientist at Sainte-Justine University Hospital Center in Montreal. Dr. Chadi grew up in Montreal and Toronto, where he completed medical school and residency training, as well as a fellowship in global journalism. He obtained a Master of Public Health at Harvard University and was the first pediatrician in North America to complete a pediatric addiction medicine fellowship at Boston Children's Hospital. His research focuses primarily on the prevention and treatment of nicotine and cannabis use among adolescents and young adults. Welcome, Dr. Chadi, and thank you for being here today.
Thank you so much, Francine. It's a pleasure for me to be here with you all today, or another day if you're listening remotely after the fact. So let's just dive right in. I have no disclosures related to this talk, and our objectives for today are: one, to discuss the short and long-term health effects of e-cigarettes and vaping among youth. Then two, apply a youth-centered approach for screening and treatment of vaping and e-cigarette use. And finally, to describe the importance of reporting illness and adverse events associated with vaping across Canada and the mechanisms to do so. So let's start with a case. Let's all meet Jeremy. He's a 15-year-old high school student, a soccer player, and also the oldest of 3 children. He has severe persistent asthma, and he was last hospitalized about 6 months ago. He was caught vaping in the school washroom. So when you speak with Jeremy, you learn that he uses a pod mod type vape, and he has recently started also smoking a few cigarettes a week. He says that he likes the head rush and the social aspects of vaping, and tells you that he uses high nicotine concentration pods, approximately 1 or 2 of them every week. He says, you know, I'd quit smoking, but not vaping, because it really helps with my anxiety. So we'll see if we can think about this case as we move forward, and maybe answer some of the questions we might have regarding this case. So I'll start with introducing some recent trends about vaping in Canada. So these are numbers from the latest Canadian Tobacco and Nicotine Survey, 29 and 2020 data. As we can see, we seem to have reached somewhat of a plateau in terms of current rates of vaping among youth here, adolescents, young adults, and then adults. So maybe good news in some way, because we had seen very rapid increases in the years before that, but still some work to be done, because we're not really able to curb those rates. And another way to look at these numbers are here, if we compare in blue current rates of cigarette smoking among young people, and then in orange, these rates of vaping or e-cigarette use. And so we can see that going from very low rates in 2013, we've reached much higher rates 2019, 2020. I want to also share some results here from the COMPASS study, a study looking at provincial data here. Here we're showing past 30-day vaping among high school students. And we can see this data goes up to 2019, that we had a very rapid increase, and that numbers are similar, although it's a little bit higher in some provinces. Here we see Alberta, Ontario, Quebec, higher rates. And really, if we compare this to smoking, we're talking about rates that are about 5 times higher. In terms of lifetime vaping, we can see that in some provinces, about half of high school students have tried vaping in their life, which is approximately 2 times higher than for traditional cigarettes. If we compare boys, girls, male, female, gender, what we can see is that there seems to be a little bit more vaping among boys or males, but that this gap is narrowing a little bit somewhat. If we look at race and ethnicity, we can see that the highest rates are found in white and Indigenous youth compared to other races and ethnicities, but increases are seen throughout. I want to also show this interesting graph here that tells us what are the reasons for which young people initiate vaping among high school students. And you can see that by far, the reason that young people will say is to try something new or curiosity, which is much, much, much higher than to use it as a smoking cessation tool or harm reduction tool, which was supposedly the reason why vapes and e-cigarettes were created, perhaps more for adults. But we can see that here we don't have this type of response among young people. When we think about how nicotine and vapes started becoming so popular among young people in the past few years, we can think of several reasons, but one of them is some of the advertising that was put out in social media and online. This is, just an example of how a type of pod mod device, some of you will recognize it, was first advertised through very positive looking, almost healthy looking images of young people. And this really had an effect of almost self-promotion. So these vaping devices, are shown in music videos and all sorts of cultural references. So they've been, quote unquote, almost normalized. And so no surprise that they have caught on with lots of young people. I want to take us inside the vaping device, just so that if we're not too familiar with them, we understand how they work. So any types of vaping devices really have this basic functioning with a battery and then a metal element that it heats up a liquid that's usually contained in a cartridge. And what comes out of the vape or the e-cigarette is what we call an aerosol, which is a mix of some vapor and then some kind of dilutants, so propylene glycol or glycerin and others. Most of the time there's nicotine or THC for cannabis vaping products, and then several contaminants or traces of heavy metals and others that get put into the mix. So this aerosol is definitely something that carries substances that we wouldn't necessarily want to see in our lungs. I want to get us through a quick history of the evolution of vaping devices. So when they first came about towards the end of the 1990s, early 2000s, most e-cigarettes and vaping devices looked like the traditional cigarette, just in a kind of plasticky, disposable way. And then as we went forward, they became larger and more sophisticated with settings. And then, some of us might remember when we first saw that big plume of smoke on a sidewalk with someone vaping. I remember that about 13 years ago. And then, more recently, we've seen a fourth generation of vaping devices that is much more discreet. And those pod mod devices, as shown here, and there's several commercial brands that we can think of, Juul, Stealth, Vipe, and so on and so forth, have really been sort of at the crux of increases in popularity among youth. We're also now seeing a comeback of some of those disposable e-cigarettes. And so I'll talk about that in a second. And I want to make sure we understand the difference between vaping devices and heat-not-burn devices. Some of us might have heard about those. They function a little bit differently because the vaping devices heat up a liquid versus the heat-not-burn devices that heat up tobacco just under the point of combustion in an attempt to bring something that's a little less harmful than cigarette smoking. And heat-not-burn devices are not those that we see as used by young people. We're really more focusing on vaping devices in what we see, and that's going to be the essential part of my talk today. So zooming in a little bit more on the pod mods, those cartridge-based devices that are so popular among young people. Well, so most of them contain e-liquids with highly absorbable nicotine salts that are then heated into an aerosol. So a typical pod can contain a concentration of nicotine that goes anywhere between, well, 0, but if we have nicotine, 1.5 to 5%, which can mean in terms of amount of nicotine, anywhere between, 15 and 100 milligrams of nicotine salts inside one cartridge, which is, in cigarette pack equivalents, anywhere between maybe 1/3 to 2 packs of cigarettes in one of these small cartridges. And some of my patients will tell me that they go through 1 or 2 a day. So we can see that this rapidly adds up. And although there is a lot of talk about restricting flavors, young people have very easy access to these fruit and dessert and mint flavored products that are still on sale in most provinces in Canada, or can be ordered online or accessed through social sources. So I mentioned those disposable e-cigarettes coming back. You can see from the graph here that they look very much like the pod-based devices. They just are one-time use. And I'm showing you numbers here from the US. I haven't seen statistics specifically on disposable devices at a national level here in Canada, but we can see that between 2019 and 2020, there was a surge that might have also been secondary to some of the legislation that was passed in the US banning flavors in other types of vaping products, but not those disposable cigarettes. But we're also seeing more and more of those in Canada. And again, they oftentimes will contain high amounts of nicotine. So I talked about the aerosols and what they contain. This is just another representation of what is in there. And as you can see by the little pictorial drawings here, there are some things that are quite concerning. We don't usually find tar in vaping aerosols, but we find all sorts of other things that can definitely bring scarring and respiratory symptoms. One thing that is also increasingly prevalent is marijuana vaping. And so we think that approximately 1/3 to 1/2 of teens who have used a vaping device have used it to consume cannabis. And that ends up to being a pretty significant amount if we think of the overall proportion of young people using vaping devices. And oftentimes what is found in these vaping devices containing marijuana is a highly concentrated oil-based THC solution. So very high potency and potentially very high psychoactive effects. And some of the terms that you might use include dab pens, and is a way of thinking about heated cannabis concentrates that young people will inhale. So these are just some images of what they might look like. So again, not very different from some of those pen-like nicotine vaping devices. So let's shift gears a little bit now and think about some of the health risks associated with vaping. And I'll bring in Jeremy again and his friend, Zach. So 3 weeks after Jeremy was caught vaping at school, he returns to your office, but this time he brings a friend. Jeremy and Zach were dripping. That means just dripping some e-cigarette liquid directly on the metal coil. And they were using those devices when it suddenly caught fire. And so what happened is Zach had a face burn and he's in tears, and he tells you that he can't tell his parents because he'll be grounded forever. And he also says, well, if I get my vape confiscated, I'm going to get headaches because every time I try to stop, I just feel horrible. Okay, so this is just kind of a snapshot of some of the health effects that can happen with vaping. And so I have a short list here of some of the more acute and some of the longer term harms, which I'll go into in a little bit more detail, starting with acute harms. And so some of you may be familiar with the Canadian Paediatric Surveillance Program, which tracks rare but severe conditions in pediatric health across the country. So we've been following rates and incidences of vaping-related injuries throughout time. And since 2015, we had 2 one-time surveys where severe injuries were identified and reported by Canadian pediatricians. And we are currently tracking on a monthly basis by regular surveys these cases as we are currently speaking. And so I'll share some of the results from the 2019 study that I was leading. which was really a good snapshot of what happened in the year prior to the study. So pretty much what happened in 2019. So pediatricians reported 88 cases of vaping-related injuries that were severe enough to require medical attention, including hospitalization or ICU visits. And most of those were related to the inhalation of vaping products. And some of them were related to the ingestion, so youth drinking or trying to swallow the vaping liquid. And so respiratory distress and lung injury represented about half of those injuries, but we had cases of nicotine toxicity, severe gastrointestinal symptoms, and neurological symptoms, in some cases burns as well. And you can see that some of those were quite severe. We had hospitalizations and ICU admissions, and some young people had ongoing health issues. I'll open brackets and talk quickly about vaping-associated lung injury. If you were following the media just before COVID hit about a year ago, there was a lot of talk about these severe lung injuries affecting hundreds of people in the US. And we had about 20 of those cases here in Canada, some of which were in young people. And so I put the definition here just so that you know what we're talking about. But these were really severe presentations of cough or respiratory distress with pulmonary infiltrates, and no infectious cause thought to explain it, and a positive history of vaping. And so I put the numbers here. We were tracking those injuries very tightly for a period of about 6 months towards the end of 2019, early 2020, and those were the numbers. And so, vaping injuries is one example of severe presentations, and we have to follow that. And just a quick addition to that, we think that nicotine, sometimes vaping products are the cause of those vaping-associated injuries, but it seems that vitamin E acetate, a product that is found in some of the counterfeit cannabis vaping products, might have explained several of those injuries. I mentioned nicotine toxicity. What does it look like? So young people may be tempted to use a lot of their vape, so go through an entire pod even in a very short period of time, which is something that some people will do. What might result is a syndrome of nicotine toxicity with violent stomach pain and dizziness and headaches, which can last up to several hours and can be quite unpleasant and also lead to some sort of cardiovascular irregularities. I mentioned ingestions in young children, and this is a page from the American Academy of Pediatrics reporting that some of these liquids will sometimes come in little bottles that might look like candy or smell nice. So we need to be careful about how those are handled with young children around. And I mentioned, burns in the story. Apologies if some of you are having lunch currently, but those are some of the presentations of e-cigarette devices malfunctioning, perhaps if they're kept in a pant pocket, like we see here with the leg picture, or some of the facial burns that have been reported. And those are more likely to happen when young people are playing with the mechanism or trying to use it in a way other than it was designed. So I want to just also mention secondhand aerosols. I get asked very often, well, is the aerosol breathed by another person also harmful like we would see with secondhand smoke? Research is still pretty heterogeneous about this in terms of how bad is it. And there is a pretty big lack of consensus on how we can compare secondhand smoke and secondhand vaping aerosols. But there seems to be a variation in the size of the fine particles that we see in aerosols versus cigarette smoke. And it seems that the particles can actually be smaller in vaping aerosols, which means better penetration deep in the lungs, and could also be bad news. The amount of nicotine that we would find in this secondhand aerosol is also non-negligible. So, if we think about this as a concept, if you're close to a patient vaping, if a toddler even is close to a parent who's vaping, for example, there is likely to be some level of risk based on the chemicals and substances that are found in that aerosol, and likely that the stronger the exposure, the greater the risk. I'm going to speak very briefly about vaping and COVID-19. There has been some talk about youth who vape being at increased risk for contracting the virus. I was told recently about an outbreak around Quebec City that seemed to have been triggered by young people sharing vaping devices. So this is still very much a current question. The question as to whether or not vaping may lead to more severe COVID-19 presentations is still something that needs to be explored more. We know that in adults who smoke cigarettes, e-cigarettes, it might be that some of them have more severe COVID-19 presentations, but we really need more data in young people. And the study here that I mentioned from Gaia and others was a little bit controversial in the methods, but it seemed to have shown that association between vaping behaviors and increased risk of COVID-19 acquisition or transmission. I want to take just a few minutes to emphasize the importance of reporting any types of vaping-related illnesses and injuries. I mentioned earlier that we're engaged in a survey currently with the Canadian Paediatric Surveillance Survey, but Health Canada has been monitoring the effects of vaping-related products, and you know, this is a statement from the Health Canada website encouraging us to report adverse reactions or incidents. And if you have a case in your practice, please do go to the Health Canada website. As simple as putting, you know, adverse reaction, vaping, Health Canada, you'll find it if you don't have the link. And take time to report this, because this really helps us, you know, collect the data and see which are the more harmful products and how potentially we can inform legislation and policies to make these products less harmful or just less accessible for young people. And this is just a little bit more about the current Canadian Pediatric Surveillance Program survey, which will be tracking vaping-related injuries for a 2-year period, if not longer. And those are the criteria. So we're really looking at young people who require emergency visits, hospitalization, or ICU based on inhalation or malfunction of a vaping device, or ingestions of vaping substances. So please do report these so we can actually follow up on that. So moving on from acute harms to longer term harms, I'm going to go through a few just here. And the first and more obvious one is to talk about nicotine, because as I said, a very, very high proportion of vaping products used by youth, upwards of 85–90%, contains nicotine. And so nicotine is a substance, not a new thing. We've known it, it's been around for a long time, and we know that it quickly enters the brain when it's inhaled, and it can also trigger some release of epinephrine, which has cardiovascular effects. In the brain, it ties to acetylcholine nicotinic receptors and has an effect on all sorts of other hormones, including dopamine, leading to a pleasurable response, which altogether, this quick onset and intense dopamine production makes it very addictive, more so than alcohol and cannabis, and similar to cocaine and other stimulants. So, you know, schematically, we have the entry of nicotine through the bloodstream or the lungs, and then reaching this nucleus accumbens, our reward center of the brain, releasing dopamine and other hormones. And I presented here our adrenal glands just on top of the kidneys, which have also those receptors to nicotine, triggering the cardiovascular response. So we're starting to learn a little bit more about longer term effects of nicotine, and most of the research available looks at data from animal studies. And what we're seeing is that nicotine does seem to produce persistent changes in the brain when we start using it as a child or adolescent. And what we're seeing is that exposure to nicotine can increase the risk for drug addiction, including substances like nicotine, marijuana, alcohol, and others, can impair on the long term the capacity to pay attention, use your working memory, and is also associated with a poor control over impulse and potentially some mood symptoms. So exposure to nicotine is not a good thing on the long term. We're also learning more about the associations between e-cigarettes or vaping products and also other substances. So it's been clear now that most young people who vape are not young people who were already smoking or who would have used traditional cigarettes. So it's an entry to using nicotine. And there is an association between using nicotine through e-cigarettes first and then going on to smoking. It's not necessarily a direct cause, but it is definitely a risk factor. And we also see strong associations between vaping and use of marijuana and alcohol and other drugs. And there's more and more research showing this. So coming back to nicotine itself, short term, I mentioned nicotine has some effect on the bloodstream, but also makes you more alert, can reduce your appetite and give you some heart palpitations. I want to talk a little bit about what happens if you use nicotine regularly and then stop. This is something that I currently hear in my practice. Young people who have taken up vaping and then stop, or have a long period of schoolwork or sports in which they can't vape. And then you see this series of symptoms in the orange box happening. So headaches, anxiety, difficulty focusing, feeling restless, hungry, tremory, sweaty, dizzy. And those can happen very quickly. For young people using a lot of nicotine, within hours, we can have those symptoms. And they peak usually a few days after last use, and they can last for a few weeks in time. And this definitely represents an obstacle for young people trying to cut down or quit. I want to talk a little bit about these two other molecules. And some of you, I'm sure, have heard about THC, or tetrahydrocannabinol, which is the main psychoactive substance in marijuana. What you may not know is that anandamide is our own naturally occurring form of cannabinoids that we all have in circulation right now as I speak and as you listen. And so I mentioned that a lot of vaping products, an increasing proportion of them, may contain cannabis. And so I'll talk to you about the endocannabinoid system, which actually is a very useful system that we all have. And so the endocannabinoid system, using our body's naturally occurring cannabinoid molecules, acts a bit like a volume control system. So when we get signals from the outside world, which could be related to pleasure or mood or pain or appetite, we need something to bring the signal back down so we can resume or continue our day in our routine. And that's exactly the role of the endocannabinoid system. So painted here in the little pink dots are all these cannabis receptors that we have in the brain. And as you can see, there are some in the frontal part of the brain where we think, and do complex mental operations. There's that C-shaped section that is our hippocampus, where we form our memories, in the back of our brain where we get coordinated. So if we get THC at high concentrations from a vaping device, for example, then what may happen is that we'll actually get a disruption in the natural and the normal functioning of that cannabinoid system. And in the short term, I'm sure many of you are familiar with some of the effects of cannabis. There is a euphoric state and then increased heart rate. There may be some changes at the extremities, some redness in the eye, dry mouth, increased appetite, and potentially some very negative symptoms from the acute use, which may include decreased concentration, impaired judgment, impaired memory, and having paranoid thoughts or hallucinations. Some young people refer to this as having a bad trip. Similarly to nicotine, if you stop using cannabis rapidly, you can have withdrawal symptoms. And those may include the list painted in the light blue box here, including cravings and irritability and anxiety and aggressive behaviors and agitation. If you read this quickly, you're thinking, oh my God, this doesn't seem very pleasant. Withdrawal symptoms tend to appear after a longer time in people using cannabis versus nicotine, because it's a lipid-soluble substance that gets excreted by the body slower than nicotine, so it takes more time, and it can last longer. So withdrawal from cannabis can last several weeks, again being an obstacle for cessation. So moving on, so there's more and more research looking at the long-term effects of marijuana, and I mentioned marijuana is becoming more and more commonly found in vaping devices, and so those include risk for addiction, altered brain development, poor educational outcome, and possibly some cognitive impairment. And the stronger the use, the more regular the use, the higher the likelihood of irreversible effects on the developing brain. There's also diminished life satisfaction and so on and so forth that can be seen with cannabis use. So what happens if we're vaping nicotine, but also vaping cannabis? And that is a good question to ask. Well, it seems that there could be a form of codependence, meaning that the potential effects of both psychoactive substances can be potentiated, leading potentially to a stronger addictive potential. The nicotine we know is more rapidly absorbed. THC takes a little bit more time, and the brain is going to be a little bit confused in trying to understand what does what and what happens. And so, we want to think about those two things and potential withdrawal symptoms from both substances if we have young people who are using both. Okay. So some other long-term health risks of vaping definitely remain unknown or poorly understood because vaping has been, so recent, and we don't have these years and decades of time to try to understand what's going to happen in the long term with the risks of vaping. But we can definitely think that there will be pulmonary risks, and that can have an impact on chronic respiratory illnesses seen in young people like asthma, and then in older people, cardiovascular risks because of some of the chemicals and toxicants found in the aerosols that can lead to heart disease, coronary heart disease. And then there are potential risks for oral health tied to some of the substances found in the aerosols, and we'll have to follow the research in terms of how the potential risks of vaping may compare to cigarettes, for example, for things like cancer. Okay, so we've talked about some of the health risks. Now, what can we do to prevent, to talk about vaping in our practices with young people? So here's Alexis. Alexis is Zach's older sister. Zach was the young boy with the vaping injury. So she's 17, grade 12, passionate about dancing and pop music. Her mother calls you and she's very concerned. She tells you that she's recently found an e-cigarette and a device that Alexis calls a dab pen in her room. She's concerned that vaping is affecting the grades. You meet with Alexis alone in your clinic and you share some of the mother's concerns. Alexis will tell you that she used to be a straight A student, but this year has been a lot harder with COVID and everything. She also tells you that she's having a lot of arguments over almost anything, and she admits to breaking curfew, but then she blushes and says, well, she did take some money from her mom's purse to buy dab cards and vaping pods, but only a few times. So it seems here that we have a young person who's opening up about some use of vaping devices, of course, and perhaps there are some effects on the overall level of functioning. Before we talk about vaping or any type of substance use behaviors, we want to make sure that we address privacy and confidentiality. And so that means clarifying the limits of what will be shared with who. So we should discuss this with every young person in a simple way as, so what we're going to be discussing today will be private or confidential between you and I, and you want to discuss what might be some reasons to break that confidentiality, and that might include things like self-harm or risks to other people that are under the age of 18 or things like sexual abuse. So we want to disclose this, especially if we're going to engage in a topic that might be a little bit more sensitive. I want to speak briefly about screening and brief interventions. So SBIRT is an acronym that we're seeing more and more to refer to a quick and evidence-informed way of screening for substance use. And that has 3 steps: screening with a screening tool, a brief talk or intervention based on motivational interviewing, and then discussing next steps, which may include referral to treatment. So what kind of screening tools may we want to use with young people? Well, here are 3 general screening tools for substance use. And as of now, we don't really have a specific vaping tool. And what the new Canadian Paediatric Society statement is recommending is that we actually screen for all of the most common substances all at once. It wouldn't necessarily make sense to screen only for vaping and not talk about alcohol and marijuana, for example. So these are examples, and you can find those online, and those can be self-administered or those can be done by a health provider. And so I'll show you what the S2BI looks like, which tends to be my favorite because it has only 1 question. So in just a few seconds, you can ask a young person, in the past year, how many times have you used, first, nicotine and tobacco products, which includes vapes and e-cigarettes and products like those. And then you wait for the response. And if you get a response for people that are teenagers, so under the age of 18, that equates to weekly or more, well, science shows us, or research shows us, that there's a high risk that they have a severe substance use disorder. You may think, wait a second here. A teen telling me that they're vaping once a week or more may have a severe substance use disorder as per DSM-5 criteria? Well, this is what the research is showing. So potentially, depending on what youth are reporting, if we get this type of answer, this should be a red flag for us. We will want to ask the same question about alcohol and marijuana. And if we get 3 negatives, we can think about stopping there for screening. If we get a positive, we may want to ask about other substances like prescription medicine or opioids or injectable drugs and so on and so forth. The Craft is another tool that I like a lot. The Craft is available in over 20 different languages on the craft.org website and is a 2-part tool, a little bit longer, but helps us guide the conversation that may come after. So similarly, we ask about past use in the past 12 months, about alcohol and marijuana and other substances, and then tobacco and nicotine products. And we can ask this directly, or we can ask young people to fill it up themselves if we print it, which actually seems to increase reporting rates. Part 2 of the Craft, and that's why it's called Craft, reports to 6 areas where substance use may have problems on the young person's life. And if we get a plus for one or more of those, well, we get a direct correlation on the level of risk of a substance use disorder. So if we ask about nicotine, we can relate this to vaping and then see how many yeses we get. And if we get many yeses to the car and relaxed and using alone and family and forgetting and trouble questions that we had here, and that I'll encourage you to go back and revisit after my talk, we have a high chance of correlating with substance use disorder. If we want to talk more specifically about vaping, well, there's a very nice clinical tool that we developed with the Canadian Paediatric Society, guiding us on which questions to ask. And I've included a few here, a few of the topics we may want to tackle with young people, including the type of vaping product, how they accessed it, the vaping products inside, the intensity of use, the context, and if there are signs of dependence and impacts on general functioning. And this may help us have a conversation, give us some key elements to rediscuss with the young person. So I mentioned, first step, we screen. If we find that there is vaping or there's no vaping, we might just want to have a bit of a conversation to try to prevent or reduce behaviors related to it. And some key points, in a brief intervention, we really want to be patient-centered and strength-based. If we tell a young person how bad what they're doing is and how dangerous vaping is, without acknowledging that they're human beings and that they have strengths and they may have good reasons to try vaping, is probably not going to go a very long way. We do want to send a clear message that not using vapes or cigarettes is the safest. We do want to provide some information about the health risks, maybe 1 or 2 key points, maybe the risk of severe lung injuries or the fact that there's a lot of nicotine in some of these devices, and then be non-judgmental. We want to listen and see if our young people are ready to make changes, and we can ask on a scale of 1 to 10 how ready or willing they are to make changes. Another framework, I mentioned SBIRT in the 3 parts: screening, brief intervention, and then referring. We can use the 5 A's that we've known for smoking cessation for quite some time to organize our conversation. So we may ask first, using our screening tool or some follow-up questions. We want to advise that quitting is the healthiest thing they can do. And then we want to know how ready they are. We can assist in quitting by suggesting some potential next steps or listening to see if they have ideas, and then try to arrange follow-up with ourselves or other people who can help. I've listed some terms that you might hear related to vaping, including some of the brand names that I hear a lot. E-liquids or e-juice is sometimes what we hear for the liquid inside the e-cigarette. I mentioned dabs or dabbing for cannabis-based products. There are some techniques that young people use, including dripping, using the liquid directly on the coil, ghosting, hiding that e-cigarette vapor, dosing, which refers to consuming larger fixed amounts of nicotine in a small amount of time, and then potentially some negative effects like getting nicked or getting nick sick from the nicotine, or some other terms you may hear. So what do we do in terms of treatment? Well, coming back to Alexis, you had a first visit, she comes back a month later after your brief intervention, and she tells you that she's still vaping, but she's unable to cut down. She continues to vape nicotine and cannabis several times a day. She tells you that she tried to quit cold turkey, but it didn't work. She was shaky, anxious, and having withdrawal symptoms. And she also tells you that her sleep and anxiety have both gotten worse. One thing that we are still trying to find answers for is what is the best way to treat young people or address vaping when there is, a substance use disorder. And we have some clues, but we need a lot more research to know exactly how we can handle this. And some of those clues come from what we've been doing with tobacco prevention and cessation. And we have these 2 Canadian Paediatric Society statements and clinical reports from a few years back that already told us that for young people with problems with nicotine through cigarettes, we should first screen and then advise not to use. And one thing that is clear, and has been clear, is that we can't think of e-cigarettes as a smoking cessation product for adolescents or young adults, simply because it hasn't been shown to be productive. And a lot of young people may use more of them or use both of them and be perhaps more inclined to use other substances altogether. So the first step and the gold standard for substance use in general, but specifically for nicotine, is to offer counseling and to try to do this motivational intervention where we have young people come up with their own goals. And in some cases, behavioral interventions aren't enough, and we have pharmacotherapy options that we can consider. So here's a quick list of things that providers are doing with young people who are vaping in North America currently. And motivational interviewing is probably the top one. Counseling and vaping cessation apps are starting to emerge. There's some more online resources that are starting to pop up, most of them in the States for now, but I've heard of some provincial initiatives for vaping cessation programs that are probably going to become available for young people wanting to quit and use technology to help them with that. Things like biofeedback or CBT or mindfulness-based strategies can help. And I'll talk just a little bit more about nicotine replacement and some medication. The harm reduction approach, switching to lower nicotine, for example, can be attempted with some youths who are really not ready to quit, but the evidence for that and how best to do it is still unknown. So nicotine replacement is something that can be used safely with young people who have regular, I would say, daily nicotine use and have withdrawal symptoms when they quit or are afraid of that. So it's always best to try to use a maintenance acting product like patches, and then add potentially the lozenges and gums on top of that for cravings in the moment. We don't recommend sprays and inhalers in young people. The side effects are usually minor, and between you and I, they will be better than the effects from the vaping device itself, so lesser risks. And we have some guidance coming from the American Academy of Pediatrics, very detailed on how we can prescribe these patches, and there's some information about this in our new Canadian Paediatric Society position statement as well. Some medications that are used in smoking cessation can be considered. So bupropion is an agent that has been shown to reduce craving in adults. Evidence is mixed in young people still. It's not clear how much it can actually help in smoking cessation and still in vaping cessation. We don't really have any clear evidence, but something that can be tried. We have to be mindful of contraindications. Varenicline, which is the #1 medication for adults trying to quit in terms of effectiveness, is something that also can be tried in older teenagers, no longer recommended in young people 16 and under because of lack of evidence of benefit. But again, the evidence needs to be strengthened before we feel comfortable prescribing those more commonly. I'll mention treatment of cannabis dependence just because there's more and more young people using cannabis through these vape products, and there are no, as we speak, approved medications that can help with cannabis dependence or withdrawal. So again, motivational interviewing counseling should be used first. There are some experimental treatments, and you might read some articles about that, promising, but still not clear how and when we should use them. And we can think of some harm reduction approaches, for example, medicinal cannabis or medical marijuana with THC, and with low THC instead of maybe some black market products with high THC. But then again, how do we engage in conversation with that with young people is delicate, because we don't want them to necessarily think that it's okay to use cannabis. But in some cases, as I mentioned, if young people are not ready to quit, we may want to try to orient them with lower potency products and perhaps less harmful ones. Involving parents is always something that we need to think about as pediatricians, of course, but in the context of substance use. And I get a lot of parents, like in this scenario we had with Alexis's mother, that get very anxious and very stressed about young people using e-cigarettes and vaping products. So parents can definitely help with the preventive side of things and should be encouraged to have open discussions with their children about vaping. It shouldn't be a taboo topic. And what has been shown across the board to help with preventing and reducing substance use problems is what we call an authoritative parenting style. So having rules and clear boundaries that are there, that are consistent and make sense, that are openly discussed with young people can really help. And that can include things like curfew or handling pocket money and driving and so on and so forth. And so parents can be guided by us, by health providers, in trying to set those rules, but they also may need some help of their own. So we may want to refer them to counseling resources and things like that. So this sort of concludes my more formal presentation. I do want to spend some time sharing some very exciting resources, including our brand new position statement from the Canadian Paediatric Society, released this week, available in French and English. I encourage you all to go read and see if you can find some useful stuff for your practice in there. There's a brand new website dedicating to all things vaping on the Canadian Paediatric Society webpage that includes the position statement and this clinical tool I was referring to a little bit earlier about specific questions to ask and how to address vaping in the clinical space. There's also some videos and some blog articles that you may want to check out on that page. The parent education website, Caring for Kids, our platform with the Canadian Paediatric Society, has a helpful page on how to talk with teens about vaping. Also, I mentioned cannabis. We have some great position statements and practice points related to this, as well as a clinical tool to focus specifically on cannabis. There are some resources and articles in Pediatrics and Child Health, our Canadian Paediatric Society journal on cannabis vaping specifically and teen vaping more generally. Health Canada, I mentioned, has been working very proactively in trying to educate Canadians about the risks of vaping. So there are some good resources there, some of them created in partnership with the Canadian Paediatric Society. There's some international guidelines if you're curious to hear what is done in other parts of the world, including an international statement that I was part of from the Society for Adolescent Health and Medicine. And then I mentioned some resources from the American Academy of Pediatrics, including some very helpful descriptions of how to go about prescribing nicotine replacement for young people. And then finally, there are several French language resources, some of them from Quebec here that I've listed. So we're encouraging you to check those out if you're French speaking or have French speaking patients. So this brings me to the conclusion. Our take-home messages for today: e-cigarettes, most of which contain nicotine and flavoring agents, for now at least, carry several acute and long-term risks, and those should be discussed with all adolescents. And it was mentioned in one of my slides, we definitely should be addressing e-cigarettes with all 12-year-olds and above, sometimes younger, because really it is so prevalent in these young people that we should be talking about it. Cannabis vaping is now very common among youth, and it does involve the use of high-potency marijuana products very often. Screening for e-cigarette use with a validated screening tool for all substances is quick and effective, and is really kind of an organized way of thinking of starting the conversation. Treatment approaches that are applicable to cigarette and tobacco use can definitely be applied to vaping and e-cigarettes. And then finally, we should think about reporting all types of injuries related to e-cigarettes and vaping using public health and Canadian Pediatric Surveillance Program channels to allow us to monitor and follow these conditions and make more informed decisions, and help our governments and policymakers do so as well. So I'm going to stop there and open it up for questions. I think this is just a quick reminder to please fill out our survey, which should be in a link in the chat box. And yes, thank you for your attention. I'll open the Q&A box and chat boxes and ask Francine to join me for the question and answer period.
Well, yes, and thank you again for everyone for their patience and everybody who logged back on. We really appreciate it. The presentation will be available at cps.ca likely early next week. And a lot of people are asking if you'll be making your slides available as well with that.
Absolutely, Francine. I'm more than happy to share a PDF of my slides. Yeah,
wonderful.
Some of the links that you can all access for sure.
So we do have a bit of time left for questions. The first question is from Martine Gobet. She's asking, in the CRAFT questionnaire, she wonders how a teenager can tell you how many days he used in a year. Can you give us an example on how you proceed?
Yeah, actually, these questions have been validated. So we just ask them as they are, and teens usually figure out how to make up the math. You know, it's what has been used as an evidence-based question. I just ask them, you know, straight away, and they'll come up with a number, or they'll approximate, and that usually works. If you're more comfortable with the kind of weekly or monthly type of answer, you can use the S2BI question instead, which I had in my slides, like how frequently in the past year, you know, have you used these products? So that might be another way of going about it.
Great. And from Marc Soucy, are teens vaping with just flavors? Example, no THC or nicotine?
Some maybe, but there's some research on this showing that it's actually quite hard to find vaping products that don't have nicotine. Sometimes the labeling isn't clear, and teens actually don't really know what's in them. So I will tell you that the vast majority of young people I see in my clinic vape nicotine, and that's what the data is showing on a national level, but it is possible to do it. We want to be careful because just the behavior and being around those products, you know, may be kind of an incentive to try the nicotine. So it's not necessarily something that I would recommend, you know, try vaping without nicotine. And as we saw, the aerosols contain not just the nicotine or cannabis, but other chemicals as well.
And what would you recommend for health promotion? Further upstream prevention?
Yeah, that's a great question. There definitely are many recommendations in the Canadian Paediatric Society statement that we highlighted that we need more large-scale education. We definitely need some regulations to better control flavors and sale to young people. Several provinces in Canada are moving forward with legislations to either reduce the concentration of nicotine of the products, restrict the flavors, restrict selling points. So I think it's going to be a group effort in terms of educators and clinicians and policymakers all coming together to try to really work on all of those things.
We have another question here. Has there been any research to look at adolescents who exercise and vape and what it looks like in terms of effects on the health risks?
That's a great question. I have not seen any papers focusing specifically on young people who exercise. What I do know is some recent papers have shown that there are definitely more respiratory symptoms in young people who vape and not. In my clinical practice, it's very common that young people who are in varsity sports or school sports will tell me, I cough more, I'm more short of breath, the vaping is really not helpful for me. So I think we have to stay on the lookout for what's going to happen next, but clearly there seems to be an impact, and it can probably affect athletic performances.
Thank you. Josette Morin is asking, I know it's complicated and political, but why would it be legal to sell these products? It's very concerning.
Yeah, I mean, agreed. It is very political, and I will just say that there are strong lobbies related to, yes, the tobacco industry, and a lot of the vaping products are sold by tobacco companies. So it is very complicated. And there's also the thing that, the fact that, at first, e-cigarettes were meant to be harm reduction products or smoking cessation tools for adults. And my presentation today definitely focused on young people, but we still have to understand if and how those products could be used in a helpful way for adults. So this is a very complex kind of policy and public health question, but it seems that we've lost the balance between having these products more tightly regulated, at least in terms of young people.
And have you seen a difference in teen use from urban to rural?
That's a good question. I think we need more research on that. I haven't seen numbers specifically. Not quite sure if it is more related to, socioeconomic status or urban rural. I think we'll have to keep an eye on this. One thing that has been noted is that typically substance use behaviors can be seen a little bit more in lower socioeconomic status young people, and we don't really see that with vaping. We see high income young people, which tend to have maybe not the same rates of substance use, or have very high rates of vaping, as I showed in my race ethnicity slide. So we have to know a little bit more about this before we move forward. I'm going to take it on, Francine, and try to answer some of the questions from the Q&A and then the chat box, because I see we only have a few minutes left. Someone's asking about vaping and using energy drinks. Well, vaping with nicotine is a stimulant, energy drinks stimulant also. So definitely if there are, cardiovascular effects to be feared with too much caffeine, or, just a use disorder related to stimulants, this can be amplified. And there has been a case of caffeine and overdose, which I could imagine with high levels of nicotine would be even more harmful. And there is theoretically a lethal dose of nicotine. In the Q&A box, I'm just scrolling through here. Someone asking about nicotine replacement and if that might have effects on the developing brain. Well, yes, because they do contain nicotine, so they are not without harms, but we probably would want to use nicotine replacement on a shorter term basis as a step towards cessation. So definitely something less harmful than vaping itself. But yeah, if they're used long term, could potentially have an effect on the developing brain. Also, someone asked about cytosine in the use so cytosine is something that is used sometimes in adults with smoking cessation concerns. It has not been studied in young people, especially not for vaping. I'll just summarize to say that even nicotine replacement, bupropion and varenicline, has not actually shown significant improvements in smoking cessation rates, let alone vaping cessation rates in young people. I think we have to think about those as tools that can be part of a toolkit. So not expect miracles and wait for more research. Someone asked about vaping and sexual activity, the effects, research on effects on sexual activity. We know that marijuana use can decrease libido and have impacts on sexual drive and performance in young people. So that's definitely something. Nicotine, I don't think has been as well studied, or I don't think that there have been really strong research on how nicotine can affect sexual activity. But I recently published a paper showing that there's increased risk for high-risk sexual activity when young people are vaping or using marijuana or both. There's a question about focusing on the impacts of heavy metal exposure from vaping. I think this is very much a question that will be answered with time. There is some research suggesting that there is scarring at a microscopic level and tissue injury related to the exposure to some of those heavy metals, but I think we're still at a kind of an animal research and fundamental research stage. We'll have to see how that actually translates into effects. And then I think the last question I'll take is, have I developed any communication campaigns focused on prevention for youths? And that is such a good question. I'm extremely excited to share that on May 3rd, there's going to be an anti-vaping day organized by students I work with in Toronto. And there's an Instagram account, and there's more than 20 schools that are involved in that. I produced some videos, and they're going to be sharing some online content. So there definitely is a drive for youth-generated content, and that's something that I'm very keen on helping with. So yes, we're working with teens as well to try to tackle this big problem. All right, I think that brings us to time. Thanks.
It sure does.
Sorry, sorry again for the technical issues and my rapid pace. I do talk quickly, but hopefully that was helpful for you all. I encourage you to go and check out the resources on the CPS website, and not to forget to report any types of injuries.
Thank you, everyone. And again, thank you, Dr. Chadi, for taking time out of your busy day to join us today. Thank you for everyone for joining us. And again, the presentation and the slides will be available on the cps.ca website, probably sometime early next week.